I'm Dr. Priya Alexander, and I'm from the batch of 1988, Christian Medical College, Vellore. And I work as a renal pathologist at the Mayo Clinic. Today, we are really honored and privileged to have with us Dr. Priya Sampathkumar. Dr. Sampathkumar is of the batch of 1985. She is a critical care and infectious disease specialist at the Mayo Clinic in Rochester, Minnesota. She is also the chair of the Infection Prevention and Control Program at Mayo Clinic. We're really honored to have her here today, as she has really done a significant amount of work in COVID-19. So, Dr. Sampathkumar, since you graduated from Christian Medical College, you have become a thought leader at several very prominent US institutions, which include the Mayo Clinic, the COVID-19 India Guidelines External Advisory Panel, and Infectious Diseases Society of America COVID-19 Real-Time Learning Network. Can you elaborate on how you came into these extraordinary opportunities?
So I'd like to say that, the foundation that CMC gives you in terms of just your clinical education, your approach to problem solving is what got me where I am. Many of you probably know that I'm married to another CMCite, and he was the one who always wanted to come to the US, so I kind of ended up in the US. And I was very, very fortunate that both of us were able to do our part of our training at the Mayo Clinic, and then have been working at Mayo Clinic for a number of years. But the training we received in CMC has guided us through all these years. It has opened so many doors for us. And the institution that I work in now, Mayo Clinic, in a lot of ways is very, very similar to CMC. So once we landed here, we felt very much at home.
Dr. Sampathkumar, you are part of an organization called India COVID SOS. Can you elaborate a little bit for us on what inspired you to get involved with this organization? And can you describe the important work you and this group is doing?
So again, it was CMC that opened the door to me. A CMC alumnus, Madhukar Pai, who's very involved in TB and global health, reached out to me and asked if I would have the time to work on a couple of documents for India COVID SOS. So I actually took a leave of absence from work and did this full time for several weeks. And the group tried to advocate for India with the US government to allow for supplies to travel to India, to transfer information through networks of that we had with institutions in India and with people on the ground, and also to inform the world about what the real true situation was in India through the global health contacts and the public health people on the ground in India. We were able to, really get good information out on the status, the number of cases, number of deaths, the scale of the problem in India. And through that, by doing that, we were able to raise funds in the US to send over to India to make a difference.
So, Dr. Sampathkumar, you did your residency at the University of North Dakota, which brought you here to the United States. How did your CMC education prepare you to take on these new responsibilities? And what were the aspects of your educational experience that you were able to share with your peers?
So CMC, first of all, the clinical education is world-class, but more importantly, the exposure to a wide variety of pathology is something that you don't see anywhere else. But probably the thing that sets CMC apart from every other institution is the work ethic. So when you see your head of the department or your, you know, I don't know, the associate professors coming in to check on their patients late in the evening when everyone lives on campus and you all work together and truly work for the patient. Nobody ever says, this is not my job at CMC. Nobody, at least when I was there, your seniors, your registrars, your consultants, everybody is pulling together as a team. And I mean, I remember being on call and having Dr. Alka Ganesh drop in at 8:30 just to check on an admission from earlier in the day. The surgical registrars, they never, even though we didn't even have pagers, you just stayed in touch and you were always able to reach someone when you needed help with a patient as an intern. So that's one thing. The other thing is the punishing schedule. I mean, I remember being on call for 50 hours straight in CMC. So after that really toughens you up. And when you come and do residency in the US, nothing seems really particularly hard after that.
What part of your CMC experience would you say has had the most profound influence on the personal and professional decisions that you have made throughout your life?
I mean, I think everything you learn in CMC kind of influences you for the rest of your life. But there are a few things in particular. One is the exposure to rural care, although I did not end up working in rural care. Our experiences in Chad and through our COP with your dad, Priya, were always very, very impactful. I think COP transforms all of us in ways that you don't even realize until many years later. The other things that make a big difference to me personally were some of the mentorship that I had in Vellore. So Dr. Bhushanam, for instance, was very instrumental in sort of being a father figure to me. And during this COVID outbreak, I've been doing media interviews in Tamil in India to sort of educate people about COVID. And I got this message from somebody who said, "Are you so-and-so? Did you live in Chennai and did you go to CMC Vellore?" And I said, yes. And he just sent me back a message saying, "My uncle used to talk about you." And it was Dr. Bhushanam who passed away tragically very early in life. So I hope I've made him proud in some way. The other people, I had the opportunity to work in Ambur for just a couple of weeks. I didn't have a bond. Again, you were supposed to go visit the place you were going to do your bond. And one of my classmates was going to be in Ambur. So I went with her and worked with Dr. Fenn. And that was such an amazing experience. And then finally, my time in Kariyar, which Dr. Bhushanam recommended that I go work with Dr. Ajit Singh. He warned me he was a very difficult person in some ways, but would also be great for me. And yes, we butted head a lot of times, but he was also incredible. And the kind of work he has done in this really remote place in Orissa was all very inspiring. And that made me want to do something more with my life than just be a doctor who sees patients and goes home.
Well, so thank you so much, Priya, Dr. Sampathkumar, for doing this for CMC. I think I know a lot of CMC alumni who are just so proud of the work you're doing. You've been really selfless, and I think you are a true lamp or a true light of CMC. You have been lighted to lighten. You have really served, and you live up to the motto of CMC so well. I am so thankful for all of the CMC connections.